Okay, guys, we're going to get started. And then if anyone jumps on after and they have questions, I can go over. So if we repeat any questions, it's because somebody jumped on and didn't hear us. So first, I'm going to introduce myself. My name is Holly Farbo. I have been with Aspen a little over 2 years. I was a clinical hygienist at an office in Indiana, Pennsylvania, for about 1.5 years, and then I moved on to the academic team where I work with students and hygiene programs discussing Aspen and the career opportunities we have. I have been a hygienist for 21 years, and 19 of those were in private practice. So that's a little bit about myself. What I'm going to do is I'm going to introduce the panel, and then, we'll start with questions. If you have any questions, there is a little Q&A button at the bottom of your screen. Go ahead and ask. You can ask them anonymously, and I will get to them as soon as I can. Okay, so we're going to start with Jennifer. Jennifer Schultz. We'll go with Jennifer. She's at my top left, so go ahead and introduce yourself and tell us how you got to Aspen.
Hi, I'm Jennifer Schultz. I'm the Territory Manager of Hygiene Support for Texas and Louisiana and Mississippi. I started my journey with Aspen about 6 years ago. I was a clinical hygienist in the New York area, Syracuse, New York. Fell in love with the company. I love what we do for patients. I really wanted to grow my career. So Aspen gave me that opportunity. I actually moved cross country. So now I live in San Antonio and I support a lot of great hygienists in my offices.
Wonderful, thank you. Leighton, let's go ahead and let you introduce yourself.
Hi, so I'm going on your computer. So I'm Leighton Seymour, and I've been with the company for about 2 years now. I joined actually as an assistant office manager, and I was in that role for roughly about 6 months, and then was promoted to an office manager. And then after being in that role for roughly 7 months, I was then promoted to regional manager of the Central Louisiana area. How I got into the dental field, I was actually a dental assistant in the military for 8 years. And I really found, a passion in it. And I was actually starting out my college career to actually become a dentist. After a couple of years, I decided I didn't necessarily want to do that. And I took a really big interest in the business side of things. And I ended up adding an additional 4 years of college on. But they definitely paid off. So far, the growth opportunities that the company has given me and the challenges that have that I've also been given to take on have been very rewarding, and I'm super excited because as far as from a growth potential, even though I'm the regional manager, my region is actually growing. I started out with 5 offices whenever I came into role last year, and I will be ending my year with 8 offices. So I'm super excited, and I'm super excited to get on here and support you guys. And then supporting me to, get our name out there and show everyone what we're all about.
Thank you very much. Shamika, we'll go ahead and introduce yourself.
Okay, I'm Shamika Blake. I am actually located in Gonzales, Louisiana. I am a clinical hygienist. I have actually been with Aspen Dental. It will actually be a year, September 9th. I have been a hygienist for 7 years, and before that, I was a dental assistant, and I was an assistant for 5 years. I'm so excited with working with Aspen Dental because of the large aspects of opportunities that's available with the company. So I'm excited to be here.
Great, thank you very much. Jennifer, go ahead and introduce yourself.
So I'm Jennifer Jameson, and I have been a hygienist for 20 years. So I did most of my time in private practice, and I was a part-time dental hygienist for a while. and I saw that Aspen was hiring. I wanted to work more full time, and I've been with Aspen for 2 years. And one thing that I absolutely love is how thorough we are with our patients. And I feel like I am actually like doing the best that I can do being a hygienist. I get more opportunity here than I have in private practice. I feel more appreciated. I feel like I've got all the tools to help my patients get healthy, things that I never had in private practice. And then I also like the growth aspect. I really want to be a territory manager one day. And then I like that we have those things that we can work for to, just make ourselves more well-rounded. So.
Great, thank you.
Yes.
So I'm going to start off here. First of all, this is laid back, guys. We want everybody to feel comfortable. Technical difficulties happen sometimes. Sometimes children run in their dogs, and that's completely fine. The nice thing about it is we're all family in Aspen. Even though we're large, we are all very close knit. So I'm going to just really quick go over what a DSO is. That's a lot of times a question that people aren't aware. They hear it, they see corporate, and that's a bad word to a lot of people. So what does that actually mean as far as Aspen and what a DSO is? So our offices are all owned by a dentist. They are independently owned. We at ADMI, I work for Aspen Dental Management Company. We don't own the offices. We provide support. So the S in the DSO is the support. And basically what that means is, for example, if a dentist gets out of dental school and wants to open their own practice, it's like, I don't want to work for anybody. I don't want to be under anybody. I want to open my own practice. Okay, well, first, you're going to need to find a place. So you're going to have to find a real estate agent, okay? The next thing is, once you get in there, you probably don't know or weren't taught much about managing an office. So you're going to have to hire somebody to do your books. So you'll need an accountant and you'll need a payroll department. You're going to have to hire people. You're going to have to deal with hiring and firing employees. You're going to have to be able to market your business, and a lot of that's not taught, and that becomes very large amounts of money that private dentists have to put in that they weren't initially, thinking about. So that's where we come in, is as the management part of that. We take care of all of that for the doctors and the hygienists so that they can focus solely on patient care. They have full autonomy to do their patients the way they want to do it. Each individual office has an individual staff with an individual doctor. So, they run things pretty much the way they want. We take care of all of those other things like marketing, recruiting, payroll, benefits, all of that stuff. So that's a little background on what exactly a DSO is. Okay, so let's start with questions. Question that says, why would I want to leave my private practice after 12 years to come to a DSO? So I'm going to let the hygienists answer that question first, and I will ask Shamika and Jennifer both. So we'll start with Shamika.
Well, you have a greater chance of running the business like you would like to, because you have the autonomy to pretty much schedule your patients as needed to allot you more time to make sure you're effectively treating that patient and able to actually discuss patient education. You have the latest technology to make sure your patient is getting the best care possible. You're able to order anything you need that would be beneficial for the patient as well. They're flexible, they're understanding, and everybody there works as a team. So if you need any help with anything, anybody is just a call away.
There, see, I forgot to unmute myself. Jennifer Jameson.
So I have a lot. One of my favorite things about Aspen is that I'm able to run my hygiene business like it is my own personal business. It's basically my baby, and the sky's the limit is how I want to do things. I absolutely love the periodontal, the SRPs, you know, when you're really getting in there. I love that I all, like Shamika said, the technology. I feel I can say that in private practice, I did 18 years, and I feel more appreciated with Aspen Dental in 2 years than I ever have in private practice. There's room for growth. There's opportunity for bonuses, which is fantastic. I feel more appreciation from Aspen, that I'm more of looked at as a leader, as a hygienist, and that means a lot to me, and I like to represent myself as that. And they give you that, you know, we're able to make our treatment plans, of course, run it by the dentist and stuff, but I don't know, it makes me feel like I'm very important in a role. Whereas in private practice, it was just, you know, kind of prophy after prophy after prophy, and you got stuck. I was like, oh, if I have to do another one. But here we have opportunity to see new patients, oral cancer screenings. I never had the opportunity to do oral cancer on anybody. And so that just, it makes it fun. It makes it so much fun when you can get done by the day and you look back and you're like, I did the very best that I could absolutely do for my patients. And to me, that's what it's all about. And, you know, they offer, you know, insurance, things that private practice never offer. And so in general, I plan to never leave. I mean, this is my baby. I love it. And I'm very proud that I made the decision to switch over to Aspen. Yeah.
Sorry, guys. I'm not gonna mute myself anymore. This happens to me every time. Okay, thank you. I appreciate that answer. That was great. So I work with students, and a lot of times the students are really concerned with, you know, going from a place where they're having 4 hours to clean teeth into an office. You know, they're afraid to be pushed into an office where they just have to, or thrown a schedule of patients. So Jennifer Schultz, I'll ask you this question. How do we ease our new grads, because we hire new grads, into our offices? What kind of training program do they have?
Yeah, I mean, with Aspen, it's wonderful. I remember when I first graduated, I was thrown into a practice and I was like, okay, figure it out. But with Aspen, whether you're a new grad or you've been practicing 20 years, we really focus on that development and that training of our new hygienists. We don't want to throw you into a practice and say, figure it out. So all of my hygienists, all the hygienists that come on to board with Aspen, they get 2 full weeks of training with an experienced Aspen hygienist. So during that 2 weeks, we have virtual classes that you can take that learn about all the different tools in your toolbox that you'll have to recommend to your patients. You'll learn how we run our schedules, how we do our new patients, the verbiage that's going to help you be successful in educating your patients on the why it's important to get hygiene care. You're going to learn our computer system, all the technology that Shamika and Jennifer were telling you about. You learn that in that 2 weeks. But going beyond that 2 weeks, you're not alone. You have a dental community. You have hygienists that we link you with, mentors. You have a hygiene coach, a hygiene manager that's going to come in and visit your office, that at any point you can reach out and say, I need your help. I need your support. And we're there. We're going to come in. We're going to visit you. We're going to coach and develop you. So as a new grad, you're never alone in any Aspen practice. You have a support system that is going to be there to help you grow. And that is our job, is we want to help you grow and help you develop and make you comfortable seeing your patients.
Great. Speaking of support, because that's something that we really advocate, that, you know, the support that we offer. Leighton, I'll let you answer this question as far as your role as an RM and how you support the offices. Can you tell us a little bit about that? It's okay if you're like, let's see here, I'll ask you to unmute. There you go.
So as far as how like my support goes, whenever it comes to like me and my hygienist, I'll talk about like an office visit. Anytime that I go into an office, you know, I always want to make sure that I connect with, you know, my people. When I mean my people, it's not just the people up in the front. It's, you know, the doctor, it's my lab tech, it's my hygienist, and I really, you know, get a sense of like how they're doing, how they're feeling. You know, we talk about their business, you know, what do they think some of their opportunities are, and just kind of get some insight of how they're feeling, because, you know, for me, it's really important that I give my support, you know, overall, and I make sure that everyone feels, you know, comfortable and confident in their role. And if they don't, if there's something that I can, you know, support in, whether it's from a consult piece, you know, if there's opportunities there, I can definitely, you know, help there. But if it's more of like a clinical part and they're just not grasping it, then I would definitely reach out to, you know, my hygiene support manager and make sure that, you know, hey, look, this team member, they're struggling with this and they just identified this. And so I'd like to make sure that I really, you know, get on top of it, because I don't want them to feel like they don't have anyone to talk to. Because it's, you know, for me, if I think back into my past, I felt there's many times that I didn't feel like I've ever had the support, and that's what made me feel like I needed to leave the previous company that I left with. And so it's so important to me as far as the communication and supporting my team members and my hygienist, that it's important that I stay on top of it, because, you know, I think I love the fact that we have such a good, strong support structure. And it's really important to me that I make it known that I'm here for them. And I keep that open door policy and, you know, that transparency that they can come to me about anything and they're comfortable doing so.
Great, thank you.
Mhm.
This next question is going to be for Shamika and Jennifer, hygiene office. Are you one hygiene office, or are you two in your offices? Shamika,
One.
you're one. Okay, and how about for you, Jennifer?
I'm one. By
You're one also. Okay. So tell us a little bit about your day and how your day goes. This is going to be a twofold question. First, give me a little rundown about how your day goes. And second, people always want to know, do you have a quota? Is there a certain amount of patients per day that you have to see?
My day typically, it starts at, of course, I like to be at least 30 minutes early before I come to work to get my area situated and make sure everything is stocked up. I always check to see what I have on the schedule, make sure I have the instruments I need. I'm very organized, so I like to have everything in order. Check to make sure that, what I check to make sure for? That my prophy angle is charged up, that my drawers are stocked up, because I don't like to go in and out when I'm seeing patients. I like to give them my undivided attention, but you have to be very good with your time management, because you have patients scheduled, and plus you have new patients that you're gonna see as well, to do comp exams on new patients. So you have to build a rapport with your patient to let them know that I'll probably step out for 5 or 10 minutes to see a new patient, but when I get back, I'll finish you up. There is no amount of patients that you need to see a day, but if you have to make sure your schedule is built so you can have enough patients on there and not have them all crammed in, and still allot time to see the new patients as well. But my typical day is filled with a variety of treatments. I don't like to do prophies all day, so I schedule my schedule how I like to work, which is do different procedures. I may start off with the SRP in the morning, but when you see your patient, you kind of get a feel for how much time you will need depending on how much buildup they have. So for some SRPs, you may need 2 hours to do 4 quads, or you may need just an hour. It just depends on the patient. So I would have start off with the SRP, and then just a prophy, just so it don't be too much on my wrist, and then just kind of mix it up like that, and a gingivitis treatment as well. And then I would just pop in and see the new patients, and that's about it.
Great. That sounds like a great schedule. Jennifer, how's your day usually go?
So I am very organized to a T, and I'm very structured. So basically my schedule starts out where I schedule, and I try to schedule, and then about 11, 12, close to lunch, I leave openings for same day starts. So I like to multitask. I know that sounds crazy, but I love it. It's fun to me. It gives me a challenge, and I'm always up for it. And so that's what I like about Aspen. I get to go check all the new patients, which makes me feel important as a hygienist, because you never get that in private practice. It's just prophy after prophy. I get to do the oral cancer screenings. I think today I had maybe five or six accept oral cancer screening. Yes, I have seen some stuff that has been, where I felt like they need to be seen by an oral surgeon. See about that biopsy. And so to me, it makes me feel like I'm doing the best that I can do. Like I was trained to do this. And so then I'll get a same day start. It could be a full mouth SRP. We do locally applied antibiotics. We do gingivitis therapy. And I'm that hygienist that is game for anything, because I enjoy it. I enjoy, like I said earlier, the harder stuff. I don't really care for a full day of prophy, so I like a challenge. And so I'm able to mix it up more during my day. My day also consists of confirmation calls, just because the business is like my baby. I mean, it's mine. And so, I treat it just as if it's my very own practice. And so I do confirmation calls, I do chart audits. And then I also help my team. They do things like the new patient exam, x-rays. I help them. I try to be that team player. So it's a fulfilled day, and it's long, and it's fun for me. I mean, because I'm able to do different types of things, like I said, other than just prophies.
Great. So there's a few different things that we do at Aspen than a private practice. And one of them is our new patient exams. At least for me, it was never done this way. So can you talk a little bit, we'll go through the process with all of you on our new patient exam and how that plays out as compared to, maybe a private practice that would just, put the patient in on a regular schedule, expect to do the new patient exam, cleaning and all that. So can you give a little rundown about how our new patient exam goes? So at this one, I'm going to let whoever's first to want to answer.
I'll take it.
Sure.
So being in private practice, we didn't do FMXs a whole lot. It was 4 bite wings, maybe a pan. I can barely say that I perio charted. We just kind of, I feel like what I'm trying to say is, now that I'm with Aspen, the thoroughness of it makes me feel a lot better about what I do. So the new patient here versus private practice is they come in, they fill their paperwork out. Our dental assistants get the x-rays. We do a pano and a full mouth series of x-rays. Then we chart all the teeth. We go over the medical history. And I usually have one of my assistants try to go ahead and go over that oral cancer screening, so I can be prepared to go in there and do that for them. And then they let the new patient know, like, hey, our dental hygienist is going to come in first. She's going to do what's called a perio chart. We're going to take the measurements. And at that point, she introduces me to the patient, and I just let them know exactly what I'm going to do, what these numbers are going to mean. And let's say we find some 5, 6, 7 millimeter pockets, and they need SRP, then I go into detail about how our periodontal therapy treatment works. And then at that time too, I'm also like, hey, do you want to get this infection out today? I mean, that's important to me, because if I'm at a place and they tell me they have to reschedule me, it's a letdown. So I try to get everybody taken care of, because that's what they're here for. And they're in here, and that's where I think that I thrive the most. Is my favorite is the same day starts. And that's where we leave room in our schedule to have those appointments. And it's fun. It's a challenge. And in the same time, though, as you may get that same day start, you're still seeing new patients. So again, you have to learn to multitask. And basically what I tell my patient, we've been working for a while. I'm going to sit you up. Do you need to use the restroom? I'm just going to take our time, make sure you're comfortable. You need any water, and then I'm going to check a new patient, give you a little time, and then we'll be back and we'll get started with the rest. And it works out perfectly. I remember thinking when I first started asking, like, oh my gosh, how am I going to do this? But it's not. It's fun. It's actually a lot of fun. And I get great satisfaction of being able to help my patients.
Great, thank you. So I'm going to go through just quickly one more hygiene question directed at Jennifer, and then I'm going to switch over to some non-hygiene for Leighton that we have, and we'll go to there. So for you, Jennifer, we said that you're the territory manager of hygiene support. Can you tell us a little bit about what that means and what you do to support the hygienists in the office, what your role is?
Yeah, definitely, Holly. So really what my role is to help them grow, help them develop, help coach them to give the best care we can to patients in our practices. So really what I do is I go in and I see how are they feeling? What do they need help with? What do they feel like, hey, I need to develop more on this. So I really get an idea where they want to go with their career, their business, and how their practice is going. And then I kind of just observe them during the day and give them that coaching, how they can become a TMHS or reach their goals in their practice. And what can they do to help patients get to yes? So I observe the new patient exams. I give them that coaching. We talk a lot about verbiage because a lot of it's about how we say things to patients is how we can get them to understand why it's important to get treatment. So I really just go in and I spend the day with them and helping them to develop themselves and making sure, you know, I always had the goal that I wanted to be more. I thought I was going to go into teaching, but I came to Aspen and I wanted to be a hygiene manager. And really my goal is to get all my hygienists to reach their goals. So whether it's a hygiene manager, they love clinical, I want them to reach their goals, and that's my job. And that's what I do in every single visit.
Great. And, you know, honestly, as a hygienist coming in, as an older hygienist coming into Aspen, you know, some people get afraid of that. Oh, I have a manager and she's going to come in and micromanage me and come over top of me. But, you know, we work so well as a team. These teams are so amazing. And your success is my success, and my success is your success. And it just works like that. And so I never felt pressured. I actually had more positivity in my daily work than I ever had at any other office. Okay, so switch gears real quick. Leighton, one of the other things that is unique to Aspen is we have our own labs right in office. How do we talk a little bit about the lab that we have and the lab techs, how we train them, what that all entails as far as our labs?
So yeah, in every single office, we have our own lab in there where we make, you know, dentures, immediate partials, and all the other like steps there in between. Our lab techs, when they come in, and this is something that I'm very passionate about, and this is something that really drew me into, is just the training that everyone goes through before they're actually placed into their role. They send them through, you know, a 2-week training period. And if they need additional training, you know, as long as, you know, we're communicating around it effectively, you know, we're going to give that additional training to that person. But yeah, I mean, it's really the training that goes into it. And if we had those labs, I mean, our lab techs do, you know, a lot, and it's just as busy as our hygiene business.
No, that's perfect. No, you said everything you needed to say about that.
Okay.
Awesome. So for our doctors who may join in or watch our AMAs, you know, the questions with new grad doctors is how do I go about owning my own business? How do what are the steps for an associate dentist and forward?
Absolutely. So whenever we bring on new dentists or even older dentists, but along with our, our hygienists, our lab techs, our doctors go through what we call our doctor development program. And we've actually just changed it up. And, since COVID, we're doing 3 days of virtual training, and it's called Discover Aspen. And then after that, it kind of helps them set them up for success so they know what to expect in their overall training. And they're set up with a mentor doctor during that time that mentors them through the different steps of their training. And each week they build upon what they learn, our systems. They learn, part of the hygiene business. They learn the lab. They learn pretty much every little part. And then once they're done with that overall doctor development program, yes, they do go into their office. However, they're still connected with their mentor doctor, as well as if they are coming in as an associate, they have that MC, that managing clinical director that's there to still continue their development. And that mentor doctor, as well as the MCD, they communicate to make sure that we're continuously developing that doctor day in and day out, building, helping them build their confidence clinically, but also just like their case presentation and building their confidence. Because, even as a hygienist, you guys, coming in as a new hygienist, 6, 7, 8 months down the road, I've seen it, hygienists, they're shy, they're timid, but I can speak of one of my hygienists now. She came in and now she's like this sunflower, and she just blossomed, and she's so just like confident and even introducing herself to people. She's just, it's awesome. And if I can speak on myself, when I first came into this role, just the confidence that the company gives you and how much time that you have to build it, it definitely is. It's rewarding. It's exciting to see each and every team member, no matter what role you are in, gain that confidence through your time with us.
Great, thank you. So we're going to address COVID because of course that's on everybody's mind. So I'm going to direct this to Shamika and Jennifer in the offices. Number one, do you feel safe? And second, how has your patient appointments changed during COVID? So we'll start with Shamika.
I totally feel safe. We have so much PPE that I wish I had a fan. It'd be cool. But Aspen has done a wonderful job making us feel safe and secure. We have pretty much everything we need. We have gowns, masks, shields, high-back suctions to prevent aerosols from flying all around the place. We do have enough time set aside to properly sterilize our room. So I feel great about it. I haven't been sick at all, and I'm
Good. Jennifer, how about you in your office?
So I have to second that. And I feel safer at work, honestly, than I do anywhere else. First of all, everybody's temperature. We all the questions. We as staff members every day get our temperature, and are we having any signs or symptoms? And if anybody even has a sore throat, we get sent home. We have to go get checked and, tested before we can even come back to work. My PPE, yes, I'm with Shamika. I wish I had a fan because I am in a spacesuit. But hey, whatever I got to do to get my patients taken care of. Face shields, booties, we're asked, we change clothes when we leave work. And I've not had one issue or one problem with anything. As far as my patient flow, in the beginning, I allowed for more time just to, see how it was going to go, see how I wanted to do everything. And now I'm just back to where I was. Now, we're just rolling like we were. And cleaning rooms, and we have so many people on staff that are jumping in to clean, and we're sanitizing everything. So it has not been an issue with me. I am not scared to come to work. In fact, when we were off for COVID, I cried because I was like, I miss my patients. I want to come back. And so I knew Aspen was going to provide us with everything we needed, and they have. They've gone above and beyond for sure.
Great. And so this is a little insider information, is that we go through Henry Schein for all of our products, and we are the number 2 right behind the US government as far as their, what do I want to say? Customer. Their customer. So we're the number 2 customer behind the US government. So we get amazing deals, and we've been able to supply, we have our Smile Wide, Smile Safe promise, where we've been able to supply our, employees with 30 days of PPE. So that's always, a wonderful thing. So let's go back a little bit more to the training. And Jennifer Schultz, I'm gonna address this to you. Even for not a brand new hygienist out of school, even for a hygienist that's joining us from, a private practice or another office, which was me. I took every ounce of that training that was given to me, because, I felt like I had to learn a lot of things again over, because I had been, in my opinion, under treating my patients for years. So talk a little bit about the training program, which we call HOP, and what that does for our hygienists. When do we send them? What is that all about?
Yeah, so we've incorporated the HOP into their first 2 weeks of training now. It's really important because I think that gives them that training a lot earlier. We used to send them to Chicago, and it was a couple months into being with Aspen. And we as a company and as the hygiene team decided, hey, let's incorporate that into their first 2 weeks, because there's so much great information. So, what we do now is some of it's virtual classes with, Maureen and Bella, who's on our hygiene support team, our vice president, and Bella. And they really focus on different kind of classes, welcoming you to Aspen. We have a lot of classes through some vendor partnerships that they can actually learn more about things that we use for our patients, such as MI paste, oral Bs, locally applied antibiotics. So we give you a full day of education on all the tools in your toolbox for your patients. And then as we go, you start getting more into, okay, let's educate you on verbiage with your patients, the new patient process, how do I present, how do I treatment plan? So that's all incorporated into that 2 weeks. And then you also are partnered with that hygienist to get that hands-on training during that 2 weeks of training. So you're in there, you're seeing how she's presenting things. So you get the hands-on and that virtual learning, and we combine that together to really give that experience. So when you're done with that 2 weeks, you can walk into your office with confidence and feel like, hey, I know what I'm doing for my patients. And, if you still need help, we can also extend it to a longer training period. That's the nice thing about us, is we want you prepared to walk in that office. So whatever we have to do to get you there to make you feel confident, we're going to make sure you have that development.
Perfect. I loved HOP. I went twice. It was awesome. So let's go back to just a general question about the offices, and Leighton, we'll go ahead and ask you this. Did the doctors in the offices have the opportunity to make their own schedules for the office? So, we're about access to care. So, how are the office hours, and how does that work as far as, full-time, part-time hygienists or flexibility in that?
So when it comes to doctors and schedules and stuff, we try to be as flexible really as possible, and try to, make it what we can make it, and also make it into, as long as we're providing that care for our patient, because, our patients, they really depend on us. Something that we really live by is the access to care that we do create, and what sets us aside differently from other companies is the access that we do have. So, aside from private practice, and I think I can speak for, a lot of people, is, we're in that healthcare business for a reason, right? We're here to take care of people. I know for me as a regional manager, the patients, they mean everything to me. And how our hours are and what we provide, we have later days for those patients who can't come in until later in the afternoon, because that's really the only time that they have available. We also have Saturdays that are available too, that, for those people who have to work all throughout the week, we're able to see them then too. And I know some of our patients are so appreciative of that it really, by word of mouth, it sets us aside different from other organizations or other private practices. Now, as far as like the scheduling and stuff goes, yes, it will differ if you talk with, different, owners that we have here and then other doctors that we have throughout the company. But I believe we're all aligned, and I know that we're all aligned on as far as the amount of access that we give to our patients, and whether it's an additional Saturday or extending our hours because we know what we're here to do and we know who we're here for, that's all throughout, and we're all here to take.
Good. Also, as far as the access to care goes, what types of specialties do we offer in the office, and what do you offer out? So are there any specialties that we offer?
Yeah, so we have specialists that come to our office. We have oral surgeons, we have endodontists, and if we're very fortunate, we get to see them, more than once or twice in a month, but sometimes in some areas they come quite often. But we do try to bring in those specialists so that we can keep as many of our patients as possible, because it's important to us to, maintain our patients because they are important to us. But yeah, we have those specialists there, so we're able to operate better and provide that fluent care for our patient.
So this will be for the hygienists, Shamika and Jennifer. As far as perio goes, when would you possibly refer out a patient, and do you refer out a patient? How far do you go with your perio, and is that something that's completely up to you? How do you do that? So Shamika, I'll ask you that question first. Do you refer out for perio at all?
Yes, sometimes we do. If it's, first off, I discuss it with the doctor, and we just kind of come to say, yes, it's too advanced. It will be more beneficial for them to see a periodontist. If the pockets are 8, 9, 10s, unattached gingival tissue, like, definitely. But the doctor would definitely make the final decision. And if he says, if it looks like it's treatable, or just depending on what he says, but we go by what the numbers say, the evidence. I can't hear you, Holly.
How about you, Jennifer? How about that?
Hey, Holly.
I'm seriously not muting myself anymore.
So funny. So as I had said earlier, I like a challenge. And I pretty much try to do everybody, and then I'll take post-op x-rays. If they're 8, 9, 10 millimeter pockets, and I absolutely feel like Shamika was saying that I cannot do it and that would benefit the patient, I pretty much have the decision. I've worked with a couple of doctors here, and I always go to them and say, this is, I can't do anything here. This is out of my range. And they're like, okay, you want to refer to perio. So in my office, it's always been my call and what I want to do. And so that's been my thing, but I try really hard not to send anybody. If I just know that I cannot do it, there's not a whole lot, maybe some surgery, some different things like that. But and there's been I've been here 2 years, and there's been like a handful of times that I've probably referred people out. And then I've also had some patients that came back and were like, they wanted to charge this and this and this and this. And we talked with my doctor, can we try it? Hey, let's do it, So it just all depends on the patient, but I have always been fully supported by my doctor on doing what I felt was best.
Perfect. Did I get it right this time?
Yes.
Yay! Jennifer Schultz, we're going to ask you this question. And compensation always comes up with everybody. A lot of the misconceptions is that we get paid on commission. And so if we don't see patients, we don't get paid. So can you talk a little bit about the compensation and our guaranteed hours?
Yeah, so with our hygienists, they get compensated a couple of different ways. They do get a guaranteed hourly pay. On top of that hourly pay, we do offer a hygiene incentive program. So really what you put into your hygiene business, as Jennifer and Shamika are talking about, and what care you deliver to your patients on that comprehensive way, we want to reward that. We want to share in the profit of the office with our hygienists because we work hard to get those patients to yes. So they do get a monthly incentive program on top of their hourly pay. You know, with Aspen, we offer benefits. You know, you get medical, you get the dental through Aspen, you have access to 401k. So you have a great benefits package along with that hourly pay and that hygiene incentive program.
Do our hygienists get sent home
You're
if
on
they
mute,
don't have?
honey.
Hi, okay, good.
Good.
Oh yeah, we can hear you.
Okay, so do our hygienists get sent home if they don't have a patient?
Absolutely not. We're having technical difficulties in
That's
the same.
okay. It's actually kind of a cool effect.
So no, we don't send our hygienists home when they don't have a patient. I mean, you heard Jen and Shamika say that, hey, we have a lot of things that we can do to help patients get that access to care. So part of my job is I go in and I help them see like chart audits, schedule audits, what they can do. There's tons of reports we can work to just really reach out to those patients that might have fallen off the schedule that need to come back to see us. So, you know, we don't make you clock out. We give you your guaranteed hours because there is so many things that we can do for our patients to get them back in that practice.
Perfect. Leighton, what is the hiring process like? What would a hygienist have to do to get hired, and what's that process like?
So for the hiring process, so we do have our own hygiene recruiters, but pretty much the first step is, well, there's actually multiple different avenues our hygienists, really can take. We have, we reach out to universities, we communicate that way, and then like we even create like different events for us to go and set up and actually speak with them. We have these type of events, like this too. But ultimately, our hygienist can go online and apply for whatever position that we do have open. Our recruiters would then, reach out to them, just to kind of, gain some knowledge, and then they would forward them on to one of the hygiene support managers, and then they would talk with them. And then after that, it would then be forwarded on to me because, we also want to make sure that they're going to be, if they're this person we really want to bring on, but they're also going to be a good fit for the office. And that's where I come in as far as knowing our people, knowing our doctors, because, like I was saying earlier, as far as support-wise, we want to make sure that everyone's a good fit for one another. So, we make sure that, hygienists coming on, we give you all the information, available there to you, so that you're completely aware and understand what all we have to offer, what different training programs we have, and that way you know what you're getting into, really.
Great. So one of the things that I hear all the time, and this is a question that we get every time, is that do you have to sell to your patients? So for Shamika and Jennifer in office, how does that, what types of products do you recommend? And do you feel like you have to sell to your patients? Shamika?
Well, we actually have a lot of adjuncts to offer our patients, but it's technically not selling it. It's just giving the patient an option to know what you need, why do you need it, and we have it if we have it available for you to help you. So it's all about promoting oral health to the patient. It's not actually selling it if they need it. So it's, I think it's an advantage that we actually have it on hand to make it more available for the patient.
Right.
Besides having to go get a prescription, go to this store, go to that store. If you have gingivitis and you need gingivitis treatment, and if we say we recommend a rinse and we just happen to have it on hand, I think that's awesome. So it's not selling to me, and definitely the oral cancer screenings, that's life changing. That's saving. lives. So it's not selling. It's thank God you have it on hand
Right.
that I can get today while I'm here.
What do you use in your office, Shamika? Which oral cancer screening device do you use? Oral ID? Okay. Jennifer,
And
how about you? Oh, I'm sorry, go ahead.
no, and I mean, it's a lot of the times when I present it to the patient and go over the oral cancer screenings, every time they say, I'll get it while I'm here, I would like to do it while I'm here
Right.
to come back. So definitely.
Okay, good. Jennifer, how about you? As far as selling and what products you recommend and
You know, I don't feel at all like I'm selling. And I did hear that also before I started Aspen. I try really hard to represent Aspen how it should be represented. I comprehensively treatment plan each one of my patients. Jennifer has been a great mentor, has led me all the way. I think about what do they need. If this was my mother, would I want her to have this? The things that I use are Prevident 5000, MI paste, chlorhexidine, irrigation, Atridox, Arrestin, all those things that I think can help the patient's oral health. I mean, you know, SRPs, periodontal disease is linked to heart disease, stroke, diabetes. So if there's something that I can do for my patients to help them, I'm going to recommend it. And I go into detail why they need it, what is important, how's it going to work. And most of the time people do great. I honestly feel my personal opinion is that everybody can benefit from Prevident 5000. I use it. My child had braces. I made him use it. I mean, it's a great product. So when I think about what I'm doing right for my patients, then that is not selling. That is being thorough and doing the very best of my ability. Again, which is why I like Aspen so much, because I have those tools and I feel like I'm treating my patients a lot better than when I was in private practice and I under treatment planned SRPs probably all day long, and I would charge out pro fees. And for me now, I mean, it's okay for me to get compensated for the work that I'm doing. For the longest time, that was a struggle for me. Like, oh, well, you know, but no, we work hard and we're giving these patients the best that we can. So I've had to really learn that about being in private practice in 18 years of that, and how much I under treatment planned. And so, like I keep saying, when I leave, I'm like, man, I made a difference. I've had patients, we take pictures before and after, and I've had patients look at their smile, start crying, and hug me and tell me, it's going to give me chills. Like, this is why after 20 years, I still do this. They're like, I work with the public. I never thought my teeth could look like this again. Oh my gosh. And then they sent their brother. And that is what it's about. You know, and that's because I comprehensively treatment planned exactly what that patient needed.
Exactly. And that was one of my favorite parts about Aspen is that you have the ability to order, the freedom to order the products that you want. You know, we have a huge network of products that are available to us, and you as your own business are able to basically order what you see fit as far as your patients. So the selling aspect, to me, these were products I would have recommended to my patients anyway, but now they are so accessible to me, and they're like Shamika said, they're right there. I don't have to send this patient out and say, oh, go look up online MI paste. Here, I can give that to you. This is a product I'm recommending. I have it right here for you. So we have about 5 minutes left. This is going to be you guys, your time. I have one last question, and I'm going to go around and allow you to answer the question, and then, you know, add in anything else that we might not have touched on. One of the great things about Aspen is we are what we call a yes organization. Yes, we will treat you. Yes, we will see you today. Yes, we can make those dentures for you. Yes, we can do whatever. What does that mean particularly to you, and how has that impacted your job every day as being a yes organization? So we'll start with Jennifer Schultz and we'll go that way.
Being a yes organization, I really think it just goes back to what we're doing for our patients. At the end of the day, we're saying yes to them. We're getting them in the door. We're just helping them get the care that they need. And that's really what brought me. I worked in private practice. I've worked in public health. And like Jennifer, I would do prophies on perio patients. And I really was looking for something that, in some place, that I could treat patients the way that they deserved. And Aspen has done that for me. And that's why I decided to make Aspen my forever home. And I can say yes to patients every day. I can do the best that they can. And that's really fulfilling. And being in my role now, I can share that passion with my hygienists. I can teach them that you can be the clinicians that we were taught in school to be. And that's really what I want my hygienists on my team to realize, that yes, we comprehensively treatment plan. Yes, we see patients. Yes, we do everything we can to get them to yes, but we're doing it the right way. We're doing the best thing for them. And that, at the end of the day, is the most rewarding thing that I have ever experienced in my career.
Thank you very much. Leighton.
So, you know, what is yes for me? So I think back at this. I've always been a positive person, and coming in with a company, or, you know, going on to a company, some of the things that I really look for is, you know, positivity. What's the environment like? You know, what is their purpose? You know, what are we doing? And so that's what really interests me in the job that I have in the military, and how it kind of got me where I am today. You know, I think back to, one patient I had consulted one time had been through a very, very just awful experience, and us giving her back her smile was literally going to be that reset, that recharge she needed. Whenever the day that we did it, it still gives me chills to this day. She cried because she was so happy, and that helps keep me grounded, because I love to see that. And, you know, being a regional manager, I now have, you know, office managers, other people that like Jen, I share that passion with, because at the end of the day, that's what we're really here for, is to give our people, or give our patients, their smiles back. And, you know, as Jennifer was saying, like, when they actually see that, they look in the mirror, and it's so rewarding. They look back at you and they're like, thank you so much. That's what it is. Honestly, I can't even say anything about it. It's kind of like, I'm speechless.
I get emotional. I know. I feel you. Thank you. Shanika, we'll go to you.
Me?
Yeah. So what does that mean to you? What does yes organization, how does that affect you every day?
Working with the yes organization means things are going to always be moving forward. That means the patient is ready to get started on their new journey, ready to be in a healthy state, ready to get the smile that they deserve and that they want. Some people wait years and years and years to come to the dentist, and then when they come and see you, and you do a great job with presentation, patient education, have all the tools that they absolutely need, and you get a great yes, you know that you all are on the same page and that you're doing the right thing. And it just makes me feel happy, glad.
Wonderful. Thank you. Jennifer.
So yes, for me is, it goes pretty deep, because I have been in situations where I was a single mom and I put my kids first. So I relate to a lot of these people that come in here. who, and I'm going to get emotional, but who haven't had insurance, who put their kids first, who had the means to take care of themselves. I'm a very positive person, and I love laughing and I love smiling. And I think that is something everybody should feel good about. So yes, for me, is me being available to do this for them, and then breaking those barriers. Hey, can we do one quad of SRP? We offer financing, and then to get it done, and these patients are so proud. It is so rewarding, like Jennifer said. In my career, I mean, Aspen has made me such a more well-rounded hygienist. And, you know, I tell them when they come in, I'm embarrassed for you to look at their smile. And I'm like, today's a great day. You have made the step. I mean, you've been waiting so long. We're going to be excited. This is exciting. And that's just how passionate I am about it. So yes, for me, is me being available to help these patients, and then Aspen offering the financial stuff and all the different options of, let's break it down. Let's do one quad. Let's do this. And, you know, people, I think I'm pretty easy to talk to, and I never judge, because you don't know what these people have been through. And so when you can be there and be, you know, kind words and encourage these people, and when they leave with a new smile, or they hug me and tell me, I'm like, man, that was worth every bit of what we had to do to get those patients. Because when I was a single mom and, you know, struggling, I never had opportunities like that. I mean, you know, in different areas of my life, but Aspen is the only organization I know that is yes today. And the yes today is what is my absolute favorite, because I never know what I'm going to see, or whose day I'm going to make, or change somebody's life. I mean, you know, and give them that smile, and when they can laugh. You know, I had a guy in here today. He said, I'm so embarrassed of my teeth. And I'm like, you do not need to be embarrassed. This is a great day. We're going to get you there. And just left, had such a sad look on his face, but when he left, was in so much better spirits, excited to get started. So I'm proud to be a hygienist with Aspen. And the last thing I want to just wrap up and say is, like, all my Aspen, it's my family. Jennifer has been amazing. I mean, not only as a mentor, but as my friend. I've gained so many friends through this, and they've all been there to support me when I was struggling with any questions, or my treatment, or what do you think this? I've always had the support, and that has made me such a more well-rounded hygienist. And that's why I'm proud to be with Aspen.
Thank you. Just real quick, my yes and experiences, you know, in the 19 years, I lost my passion for hygiene. I was burnout. I lost that, and I was able to get that back through Aspen. And so I believe in this company, and I do what I do every day to get this word out, because I want people to know how wonderful this organization is. And all of you, Jennifer and I have spent time together. I mean, we're friends, everybody. And I get emotional too, because it's just a really great feeling to be able to have this kind of support. So thank you guys so much. This hour went so quick because you guys are awesome. So thank you so much for being on. I loved having you, and I hope to have you on again and meet you guys in person someday.
Thank you for having me.
Oh, you're welcome. Thanks, guys. Thanks so
Thank you,
much.
Holly.
Thank you.
Bye,
Have a great
everyone.
night.
Thank you.
Bye. Have a great night.
Bye, Shamika.
Bye-bye. Bye, guys.